pointers. So I'm going to introduce Justin Barney. Hi, Justin. You're at the bottom left of my screen, so that's why I'm looking downwards just in case. Justin, the floor's yours.
Great, thanks, Ricky, and evening, everyone. Thank you for giving up your time to join us, and thank you for stepping up to be the first wave of community champions. We've developed this program building on the experience, particularly of Newham in East London, who developed the idea of community champions because what they were starting to see is that people were confused about what the guidelines meant, that it was hard for the council and for the NHS and partners to hear what people's real experiences were and what some of the challenges were. So by developing the community champions, it's very much a two-way conversation. I think it's a really great opportunity for you to help us, but also for us to help you in a way that's useful. And as Ricky says, this will be a learning process. We won't always get it right. So, keep that in mind and be compassionate with yourselves and with each other as we go through. But it is, I think, a real opportunity for you to help us do better in getting the right information out to your families, to your friends, to your communities, to hear from you what the questions are that we're not answering or we're not making clear enough. I will put the caveat that I can't do much about what the Secretary of State wants to do. I have limited influence with government. So any attempts to ask me to just solve world peace, the laboratory booking system, all of those things, there are limits to what we can influence. But that being said, actually, there are it has been really important. Some of the community feedback we've already had, particularly where we've been meeting with faith leaders, has helped shape national policy. Some of the feedback we've had where people have had less than satisfactory experiences at some of the NHS test and trace sites, we've fed straight back and we've seen improvements and changes happen. So it is important that this is a two-way and you help us, because it will help not only Birmingham, but I think it will help the wider region as well. I'm really excited. There's over 240 of you already, which is fantastic. Ricky and the team have got a target of 1,500, so there's still a bit of a way to go. But every step counts, every person counts, and the information that we're sharing with you, the conversations we'll be having, whether you're just sharing those with your immediate friends and family, whether you're sharing them with a congregation, with a workplace, with a wider network like the Rotary Club, doesn't matter. Every conversation counts at the moment. COVID is no less dangerous than it was in March. We are already starting to see escalation in hospitalisation, people going into hospital. Sadly, we're now starting to see the impacts of the first spike we had in August is now starting to play out in deaths, in those starting to rise as well. So it is important we take it seriously. It's important that we use every method we can to get the right information into people's hands, the truth, the facts, and help them protect themselves, their families, and our communities and our city. So that's what the Champions is about. That's why we're putting the effort in to make this real. And I'm sure that's why many of you have chosen to step up and take part in this as well. It's great. We've got the final thing I'll say before I shut up and take questions is I'm just so pleased to see the geographical coverage across the city. It's great to see such diversity in terms of geography. Looking at the names and what people have shared already, how diverse this group is brilliant. But bring it on and bring your friends and get more and more people involved, because it is important that the champions reach as far as possible across the city and into as many communities as possible as we can, to really make a difference. So I'll pause there. I'll just remind people who've just joined us to mute. This is the joy of digital meeting. We're all learning the etiquettes and the approach. Happy to take any questions that anyone has specifically for me tonight. One of the things we will be doing is trying to make sure these sessions do happen regularly. Sometimes it will be with me, sometimes it will be with other members of the team who lead on different parts. So might have one of my consultants, Mary, for example, could come along and talk about drop and collect and what we're doing there. Or you could have someone like Elizabeth, who might talk about some of the work that we're doing with contact tracing, or Hamira, who works with schools and universities. So we're going to try and vary it up, and some of that will be about what you tell us you want and where you want to dive a bit deeper and find out a bit more. And finally, there's no such thing as a stupid question. These are changing times. The guidelines keep changing. The situation keeps changing. What hasn't changed is the virus, sadly, and we still don't have a vaccine, and I don't expect to see one this calendar year. We have treatment that reduces the chance of people dying if they catch it, but not that kills the virus itself. So we're going to be in this situation, I expect, for at least another 6 months, possibly longer. So it is the new normal, I'm afraid, and that's going to take, it does take all of us some time to adapt to. So I'll pause there. Ricky, do you want to pick questions, or do you want me to take them straight from the chat?
We've got some, I think it might be easier from the chat. So then at least we've got it documented, and those people who are going to be recording this, who are going to get on record, they'll have an opportunity for it to see it. So okay. I think the first question's from Rachel, which is, have we seen any spikes at Birmingham University campuses as per national coverage?
Right, so we have seen cases across our universities, and I'm expecting probably tomorrow or by the end of the week, all the universities will start to publish data on how many cases they've got in staff and students, and also of those cases, how many had actually been on campus in the 2 days before they developed symptoms. What I can say from the data that I've seen is that we have 87,000 students in the city, and across all of the 9 universities, we have 5 big ones and 4 little ones. We only have about 300 cases in total. And of those 300 cases, the vast majority have not set foot in a classroom or on campus in the 2 days before they got sick. Some of them are in halls of residence, but we're not seeing the pattern that areas like Manchester and Liverpool have seen, where we've got 50 cases in a hall of residence. We haven't got that. We have got a couple of halls where we've got 2 or 3 flats, where everyone in the flats caught it, but it doesn't seem to have spread. And we're doing additional testing to make sure it hasn't spread and to keep control on that. But I actually think at the moment, the university situation here is looking pretty good, but we'll see. I mean, a lot of this depends on how students behave, and over 60% of our students who attend the 5 main universities in the city don't actually live in Birmingham, and so one of the things to keep in mind actually is that if they live in Dudley, for example, and tested positive, they'll still register as a student at Birmingham City, for example, in terms of the student numbers, but they won't be a Birmingham case. They'll be a Dudley case. So it'll be interesting to see how that plays out. I think we're as well positioned as we can be. I've been working with the university since March and quite intensively over the last 3 months to prepare for autumn term returning. We've got testing sites co-located. You know, we've done everything we possibly can. And there are behaviour contracts in place for the students. There's quite a very strong expectation on what they need to do and what happens if they don't as well. So we'll see how it plays out. But at the moment, we're not seeing the same pattern we have in some of the other parts of the country. And I hope that's going to continue.
We've got a question from Amy Watson, which is around mental health. What extra resources are being put into that?
Yeah, so there's been quite a lot of work done on mental health already. Particularly, mental health is predominantly commissioned by the NHS rather than by the council. So, and the NHS commissioning is run through things called clinical commissioning groups. So they're called CCGs. And Birmingham Solihull CCG and West Birmingham, which is part of a different commissioning group which links to Sandwell, have been working together pretty much since March again, actually, to make sure that all mental health services were accessible. So things like PAWS, which is the mental health support service for young adults, moved to online. The mental health crisis support team were able still to provide face-to-face support for people in crisis in a COVID-safe way. So, and the hospital, the mental health trust, was still admitting patients in a COVID-safe way. So there was a lot of work to make sure that services we already had still worked. And then there's also been work to look at what else do we need to do? What else can we do to support people? Some of that's been in the wellbeing space that the council's led on. So we commissioned, for example, a series of YouTube videos on things like yoga and mindfulness, but also some quite interesting stuff on creative art, on how to use creativity to talk about death and bereavement, for example. So there were a range of different things in that kind of well-being space. In the early intervention space, things like Couth, which is an online digital platform, was commissioned by the CCG to support young people's mental health specifically. And then in the background, there's also been a lot of work around suicide prevention, because we've been very conscious that some people who've had to isolate during lockdown have been very, very isolated, and that has been very bad for their mental health. So there's been a lot of work around services and support, and that continues to keep going, and that has mean additional money's been spent by the NHS to commission more services like Couth to step in and provide support. It is one of the realities of COVID that there are these extra impacts, and the things that we have to do in our own lives to stop the spread, like not giving mum and dad a hug and not going over for Sunday lunch, do have an impact on your mental health and onto your parents, for example. And that all is starting to add up, and we've got to talk about it, and we've got to talk about the support that's there and help people connect to it.
Thanks for that, Justin. This is from Debbie's iPad. It says on here, is there any way that the likes of schools could like early year settings, have access to a token number of test kits, especially as young children easily come down with coughs, which is one of the symptoms, to then exclude the children?
Yeah, it's certainly something I'll take away, Debbie, and ask, actually, because one of the things, so schools have got a small number of test kits to basically, if a child becomes sick at school or a teacher becomes sick at school, then they can send the child home with a test kit. And that's the idea of those kits. So they are supposed to be there as a kind of emergency, because actually people in general can still get tests through 119. And Birmingham has one of the highest testing rates in the country. We have more testing sites than any other city per head of population. You know, we've done very well to get the testing access that we have. The Department for Education, who are responsible for getting those testing kits to schools, are currently building the same model for universities. And I think it's a good suggestion to say, well, are you going to do the same thing for nursery provision, and start to think that through in the same way. So I'll take that one away, Debbie, and raise it up through the channels. Can't say I'll solve it, but I'll definitely raise it because it's a good point to make.
So we've got Dora Eskeren asking, are we seeing older people numbers increasing?
So we're seeing an increase in all age groups. And that is concerning, because this is the point the Chief Medical Officer was making, I think, on the TV last week, is this is why it's so important that young adults and take responsibility for this as well, because if we just think about this being about what I do to protect myself, then it forgets that the fact that I go and touch things and I spread the virus, and that someone else who's much more vulnerable might come along and touch that same door handle or stand next to me on the bus and I'm not wearing a face covering and I infect them. And they may be much more vulnerable. And we've certainly seen in the hospital admissions, particularly in the intensive care admissions, that it is more elderly people who are ending up in intensive care and ending up incredibly unwell. What is different this time from the first wave is we're not seeing many cases in care home residents at the moment. We have seen cases in care home staff, but at the moment the number of residents has stayed relatively low, and we certainly haven't seen the outbreak in care homes that we saw before, where care homes were getting 10 or 20 cases. At the moment we're still seeing up to 4 or 5 cases maximum, but actually staying very small numbers, which is good. Sadly, that is one of the reasons we stopped visiting to care homes, was to protect the people in the care homes, and I know that's incredibly hard, both for the residents and for the families. But it has been done to protect them. And at the moment, it is doing exactly what it says on the tin. It is protecting them, and the numbers are staying down. But in the wider community, we have definitely seen an increase in older adults, as well as other age groups.
Okay.
I think you glitched, Ricky. You're still there.
Ricky's frozen. Shall I? Do you want me to?
Yeah.
Do you want me to take over?
Yeah.
Yeah. So we've got a question from Debbie Board. Is there any indication when GP surgeries and dentists are planning on opening for face-to-face appointments?
Yep, so dentists are already doing it, and so are GP practices. The important point is to make that in both cases, they are working out whether you really need to come in. Now, with the dentist, generally you do. In fact, I went last week and had my dental hygienist appointment, which was long overdue. So they are different dentists are doing it at different stages, and that's to do with what the dental setup is and can they make it COVID safe. I have to say, having experienced it myself, it's not quite the same, because there are some bits of kit they can't use. So there are some things they can't do. So they're not allowed at the moment to use particular types of suction. They can't use the electric polishing brush, for example. So I had to have my hygienist appointment all done with old-fashioned scrapey tools, which wasn't quite the same experience. And I can see from those of you with cameras on, I'll stop the description there. But it will vary, and there are some things that they're still not able to do because of the risk in terms of dentists. In terms of GP practices, I think almost all the GP practices have the facility to see someone face to face, but they're only bringing people in to see them face to face if they need to. So if you ring for a GP appointment, normally what's happening now is you'll get an appointment to have a telephone consultation. And then if the GP or the nurse feels you need to be seen face to face, they can arrange to bring you in quickly for that to happen. And I think, as some of you know, I'm married to a GP who works in Small Heath, and he's been talking about actually how it's working really well, and the vast majority of stuff can be done over the phone safely, but also if they need to get someone in, they get them in quickly and they can be seen face to face. And I know it's a different experience for people, and lots of people like to talk face to face to their GP rather than do it through a camera or do it through a phone. But actually what they're finding is that more people turn up for their appointments on time. There are much, much fewer do not attends. And actually that people are getting a better quality experience because it's all flowing a little bit more smoothly. So GPs, it's there if you really need it, but they will only bring you in if you do really need it.
There was a hand up, Justin. It was COUAMDMD. Do you want to voice your question, please? COUAMDMD. You want to voice your question?
Yeah, thanks, Habib. It's Majid, also known as Councillor Majid Mahmood Bromford and Rajjo Ward. Yeah, I've actually put the questions in the chat now, because you did say well, you know, Ricky did say put them in the chat, but there's
So
three
ask your
particular
question.
questions. Yeah, the others have been asked, so I'll be quick and I'll shorten them to what I put in the comments, but just have a look at the comments. The first one is around the household mixing. The World Health Organization recommends that where you've got vulnerable people in a multi-generational household, that the vulnerable, the elderly especially, wear masks, but we've not actually given that advice as Public Health England. And with that also, there's no information that I can share with residents and people across the city around where you've got children going to school and elderly people, around not having staggered meal times, so you have less sort of mixing within the household, and around the cleanliness of the house, you know, door handles and those facilities such as bathrooms and toilets. Secondly, there's a question around the conspiracy theories and COVID deniers we've got in the city. Whenever I publish a post on Facebook, I'm constantly having to delete comments from COVID deniers and conspiracy theories. If we can just have some information on how we tackle those individuals that constantly are coming on to our posts where we're trying to support people across the city. And the third question is around the door-to-door testing. There's some anxiety from residents in parts of the city around the involvement of the army. The best way to tackle that would be to recruit local volunteers who know the communities themselves, especially in areas where English is a second language. I volunteered myself on my way to a call from officers to assist in parts of the city because I can speak some languages from the Indian subcontinent. I think it would be really useful in those particular areas. Thank you, Habib.
Great, thanks. And stealthy label, Councillor mentioned. Yeah, on intergenerational, good. You know, we. So simple answer is there's a thing called germdefense.org. It's a website. It covers, I think, about 100 languages. It's all about what can you do in a household to keep each other safe. So that's the first starting point, but we will have a think about what else we can do. And I think that idea about staggered meal times is a really good example. It's a really practical tip. In terms of COVID deniers, and I see someone's put in the question about how to respond to Donald Trump, and that's far too political. I couldn't possibly. But you know, the reality is, in any situation, you get deniers. And it is a real challenge. One of the things we might think about is doing a kind of here are the common myths and here's the facts, you know, because some of them it's really straightforward. You know, 5G is about your mobile phone and its radio waves, and the virus is a little creature and it can't ride on the radio waves. So the two things are completely different bits of science that just don't join up. But there are some quite sophisticated ones out there as well who also try and put up bits of research which are, you know, some of them are real research, but when you actually read who's done it and how it's been done, it's so wrong, it's not true. And you know, but unless you're looking at it as a scientist, sometimes it's hard to see that. So I think that's a really good call. On the drop and collect, we are recruiting. We have been recruiting through Hayes, local people into fixed term contracts to join us. So I think at the moment we're up to about 38. I think there's about another 40 to be recruited. And I'll work with Habib and Ricky to how do we get information out so that you can signpost people. We've also been working with local voluntary organisations to bring in voluntary groups as well to partner with us on this, because the idea of having a volunteer and a member of staff together, the army support is only there for a short period of time. So we've only got them for about another 2 weeks. And they're there to help us because obviously the numbers have been rising and we need that additional support in the short term while we're getting in the Hayes posts and people appointed as more substantive people to support this program. So it is definitely in training and you know, I'm really keen that we get create job opportunities where we can in our communities where we can, and even if it's a job for 3 months, that may well help someone who's been really struggling during COVID. So we'll look at how we can get those things out. I'm conscious lots of questions, so Habib, shall I whiz through some of these now?
Whiz through. Do the Donald Trump one, please.
Yeah, so I'll go through them. So Chris Milton, How can you respond to Trump after his words today? Personally, I'd switch the channel and look at something else. He's not an oracle of how to respond to COVID, and that's probably about as political as I'll get today. In terms of the second part, are the figures in Birmingham developing? Generally, we're getting better at the moment, and that's a reflection of everything we're doing. Now, what I would say is I need another week of getting better before we can make a strong argument to government to relax the restrictions. There is quite a strong chance that next week they're going to change all of the national restrictions and things are going to get a lot tighter. And the big question for Birmingham is, if we keep coming down, then we'll probably go into the lowest level of restrictions. If things stop or they get worse, then we will get many more restrictions and we'll probably end up in the same kind of situation that Manchester is at the moment. So it really does depend over the next kind of 5 or 6 days of data and how things, and how the city behaves. But things are definitely working, and there's lots of good signs that everyone is listening, they are paying attention, and they are doing the right things. Paula asked about, is the schools data showing transmission from children or from staff? So what the school data in general is showing us is that transmission is not happening in the schools. So we've got some really classic examples of, for example, one school, 6 children, 4 different year groups, and then the connection was all the children had been to one of the children's birthday parties. So they'd either been themselves or they were a sibling of a child that went, and all of those households that had someone at that birthday party ended up being infected. What we're not really seeing is that within a class bubble, there's spread happening, which is interesting because that's what we would expect to see if children were really good at spreading this. So what that suggests to me is that actually the schools are being really good. They're managing the situation well. It's the things that happen outside school where the kids are meeting up where it's not going quite so well. In staff, slightly different picture. We are seeing some spread between staff in schools. Some of this is about lunch breaks and coffee rooms and staff room behaviours. Some of it's about staff sharing transport to school, so sharing cars, for example. But we haven't yet seen schools where COVID has spread through the school. What we have seen is schools where they're schools in communities where COVID is high, and that's reflected in the school in the same way it's reflected in any other setting in those communities. Jane asked a question about the dashboard and can we get it out more frequently? Yep, so Ricky and the team are working on that. That was our first attempt. Ricky can tell you another time the pain that we went through, because actually, although it looks really simple to you, we've had to do a lot of work behind the scenes to try and make it automatic, and that makes it faster to get out to you, but that will come out weekly. And we're trying to give you the most accurate data. So the other thing is, we could give you data every day, but it goes up and down because people test less at the weekends. And then the lab results also tend to bunch up over the weekend. So we always see this pattern where case numbers are highest on a Wednesday and lowest on a Sunday. And therefore, when you look at the rate, it goes up and down during the week, depending whether Wednesday is in the last 7 days or not. But we are going to try and get that out regularly. The dentist point raised again by Jules, yeah, we know it's an issue. It's a national issue about dentists. And, it's fair to say, I think some are probably prioritising their private clients. Adrian asked about benefits from drop and collect. We have seen benefits. We've actually just been doing a piece of work on this that we'll probably be able to publish and share with you next week. That shows we are finding cases through drop and collect. It varies a lot. Now, in some cases, about 1% of the tests that we distribute are positive. In other cases, it's been as high as 12% of the tests that we've distributed are positive. And as we go, we're learning, because again, this is a new way of being. It's about the 3rd scheme in the country to be supported. So, we are seeing that and we're getting better at targeting it now into the areas that need it most, and that's playing out in us finding more. And where we found cases, the other thing to say is it's helped us join the dots. So in one particular area where we went, where we found it was 7, 8 additional cases, through the contact tracing, that did suddenly unravel why we had a cluster on that particular area, because there had been a party that no one had fessed up about, and suddenly we found the house where the party was, and lo and behold, it all joined together like a jigsaw. Drop and collect is very much about finding the jigsaw pieces we can't see. That's what it's there for. So Anelia was saying, query about older people, about how do they get support. So through the council website, and we can get that put out through the text message and email tomorrow, Ricky, or the next one, about a link to where you can find support. There are additional support services that were put in place during COVID as well. Desmond, do you want to retype your question? Because it says, will we be getting UDOT? And I'm not sure what UDOT is. I think you typo there. So question from Alison. Yeah, so people, question around, there were people were uptight, or getting upset about drop and collect because they didn't know it was happening. And people thought it was a scam. So the challenge we've got on this, and again, this is one way, if you've got thoughts, do email them into us, is we choose where we're going tonight, and it's based on the data that's come through today. So it's a very reactive service. So what we can't do is go round 3 days before and let you know it's coming. What we're trying to do is use Facebook, use social media, let elected members know the day before, this is where we're going to be, so that they know. We've been putting out a lot of messaging going, this is what you should be looking for. People have got high-vis vest on, including the RAF. They're wearing the vest. It says Birmingham City Council. They've got a letter with them. There will be people with them who've also got IDs as well. So all of that's there. And we'll be doing a lot of publicity to help people understand what's going on. But if you've got any other thoughts, and again, we'll be able to tell you as champions, and that's another route that we can start to use, is say to you, actually, it's going to be in these areas tomorrow. So if you know anyone, let them know, and help you get across the message as well. The question about Neela about day centres. Yep, so there is a piece of work looking at day opportunities and what can and can't be done safely. And at the moment, it's got to be very, very cautious and slow. So John Williamson, the council, is leading on that. So if you are a service provider that works with older people, then please link in through adult social care, because they've been doing very specific on that. Durette asked about some people getting a home visit to have a COVID test. That's the drop and collect. So what's happening is we're going to very specific areas where they've got spiking cases, but not enough people testing, and we're trying to test the whole street. So that's what's happening there. The people are given the test. They then have to go indoors, take the test, register it on the website or by ringing the phone number, and then we collect the test from them about an hour later. Which is why it's called drop and collect. So, oh yes, yeah, so the questions from Majid we've answered. Yeah, so Desmond, I think I picked up the point about the areas. We'll look at what more we can do to get the messaging out, whether, for example, we can publish them on the website each day might be one way of doing it. As I said, I want to keep this quite a reactive thing, because we are changing areas. We set out at the beginning of the week thinking this is what we're going to do this week. Because we see different cases come through on a daily basis, we have changed it, and we do change it quite frequently. And I don't want people sitting in just because they think it's going to be coming and then getting disappointed. So, but we can look at what more we can do. And I think, Ricky, we can pick that up with the comms team. Vaccination. Okay, so question from Desmond about vaccination and priority vaccination. So there is not going to be a vaccine before Christmas. I have seen no evidence that it's coming this side of the new year. What I have seen is a lot of NHS exercise planning going, how are we going to vaccinate the whole country? How do we do it if it's one injection, if it's 2 injections close together, or it's 2 injections far apart? How are we going to prioritize it? Can we do it, and how long is it going to take? So there's been a whole load of modeling, but the reality is the vaccine is not ready. When we do have it, there will be a prioritization. I expect the prioritization will start with NHS staff in order for them to work safely with patients with COVID. I expect I'd hope they would extend that to social care staff. And then they will probably follow a format which goes with the most vulnerable first, i.e. those with long-term conditions, the elderly, and probably those who are clinically obese as well, and then move on to other communities. And ethnicity is certainly being considered in part of the flow, but where it comes in the order, I just don't know. Like every other vaccine, it will be voluntary. And there's a lot of people to vaccinate. And if you think it takes us usually 6 months to vaccinate everyone for seasonal flu, or at least 4 months, and that's not even half the population, we're going to be vaccinating probably this time next year, I imagine. So we'll see. But I think my answer to most people on vaccine is just go, calm down. It's not going to happen this year. So, it's not, I wouldn't get too excited about it at this moment. It's not going to save Christmas, I'm afraid. So question from Amy about mental health. I think it's a good idea. We can have a think about what more, and actually also reach out to the Mental Health Trust and to the CCG, because one of the things we want to do is the Champions Build Up is thinking how could this network of people connect with some of the other partners and them come to get involved in this. Desmond asked a good question about how can we reassure people who are feeling unwell to use the NHS, and how do we avoid them leaving it till too late? And that's a really important point, because we saw that in the first wave, particularly in Birmingham. Birmingham had a large number of people who died from other things as well as COVID than other areas. And it's a really important message to get across. The NHS is still open. The NHS has thought about how to keep you safe. And if you've got symptoms of anything, if you're feeling unwell, do what you would do in normal times, whether that's ring a GP because you're feeling mildly unwell, or ring an ambulance because you're severely unwell. But what we don't want is people sitting at home and struggling on, because ultimately what happens is when they do call an ambulance, they're that much sicker and it's much harder to save them. And there's certainly evidence from the first wave that we lost people because they were just too scared to come into hospital and they stayed at home. And by the time they did come in, they were so sick that we couldn't save them. Okay. So question from Mike about, can we give a heads up on the announcement tomorrow? Well, all I can say is at the moment, I'm not expecting any change for Birmingham tomorrow. That's about as far as I can go at the moment. I don't know what's going to happen in the rest of the country. There's loads of emails flying around about the north. We will see. But I'm not expecting any changes for Birmingham at the moment. Okay, and okay, question about Alison about independent living. Yeah, really interesting. So one of the big challenges we've had as a council, and we've lobbied really hard on this, is about what's a care home, what's not a care home, extra living support, extra care, etc. And it's a double-edged sword in a sense, because in the beginning, the Department of Health were really clear. Care homes were really just residential care homes, and extra care facilities were not considered care homes. And so they didn't get access to testing, They didn't get access to personal protective equipment. They didn't get the same support that care homes did. So on the other hand, we argued for them to be in the bundle. And of course, once they're in the bundle, anything that applies to care homes, like restrictions on visitors, applies to them. So you kind of got to be a bit careful about what you wish for. I think it's better for them to be in the bundle for care homes and get all the support, and accept that does come with the downside of the restrictions, than be out of the bundle. There is a national task and finish group looking at visiting in care homes. We recognise, not just in Birmingham, but across the country where there have been restrictions, that this does impact, and we need to find a solution, but it's got to be a solution that protects care home residents. And it might be, you go and visit your parent in a care home and you think you've done everything right, but you take COVID in, and although it might not kill your mother or father, it might kill other people in the care home. So it is something that's being thought through at the moment. So Catherine asked about laboratory capacity. So laboratory capacity is being organised nationally. It's not something we have any control on locally. It is increasing, and University of Birmingham has just come on board as one of the new national laboratories. We did try and make an argument that it would be really helpful if Birmingham kits went to Birmingham Laboratory, because it saves the road traffic time, saves the carbon footprint of taking them to Milton Keynes. So why don't you just send them here and it's faster? As far as I know, we haven't won that argument yet, but it should help us in terms of capacity and flow. In terms of evidence to show that people who've got antibodies won't get COVID, really important question, Claire. There is clear evidence now in the UK of people who definitely had COVID, who definitely caught it again. So you can catch it twice. And that's probably because we know some people who have COVID don't develop antibodies. Of those that do develop antibodies, some of them, the antibodies just don't work properly. They don't defend them. And also, for some of them that do make antibodies, their body forgets how to make them quite quickly. And the way to kind of explain this, I suppose, is I think there are some vaccines that we have to have repeatedly through our life, like a tetanus booster, because our body kind of gradually just forgets how to make the antibodies. Well, it's a bit like that with COVID. We're not very good at protecting ourselves from this virus because it's part of the common cold family that we don't protect against generally very well. And for many of us, when we do develop antibodies, they just don't work, or we forget how to make them. So this is why I say don't waste your money on an antibody test. In terms of the data that's coming through, Desmond asked about how soon do you get up-to-date information. So basically the data that comes through to us is usually about 3 days old, give or take. So the data that comes on the national dashboard, the most recent data that's been published tonight goes up to the 4th of October. And that's on the NHS progression dashboard. And then about tomorrow lunchtime, I get the equivalent data for the testing, what percentage of tests, and that's because they have to do more cleaning on it. It's also because of the laboratory delays nationally, it takes 3 or 4 days for data to come through. So that's why they delay it. But we are getting cases through every day. As soon as the lab tells the person they're positive, that goes into the national contact tracing system. And then we get the information after that. So we're usually running about 2 or 3 days behind. And that's why it's been really important working with things like schools and universities, because they tell us when they know they've got someone who's test positive, which is normally 2 days before the national system knows. So we're just getting on and deal with it. And that's helping us. So Debbie's iPad said, yes, I can agree. As the school governor, it was the teacher that caused a bubble to isolate, and 2 other staff test positive. And so so far, no pupils testing positive. We are seeing that. And that's the reflection of this is happening in the community. Bosmandina asked about, is it possible to find about certain areas rather than just Brum as a whole? We'll have a think about how we can do that in the dashboard. We do have the data, and it's on one of the national platforms where you can have a look if you want. What I would say is we've got areas that have more cases, but we now don't have areas with no cases. There was a period about a month ago where Sutton Coldfield had less cases than the rest of Birmingham, and most of the cases were in the Hall Green constituency area, but that changed and it's rebalanced again. At the moment, Edgbaston, Selly Oak's going up, but that's because of cases in the halls of residence. You know, and we do see this back, you remember, I think back in May time, Erdington was standing out, and the area around Chester Road, that's because there are a lot of care homes there. So, you know, it's an interesting part of that. Majid asked about, have we got the right figures now after government had the data glitch? I think so. I say I think so because I really want to get, you know, I won't be confident we've got all the numbers through correctly until about Friday, knowing just the way this system works. You know, I think that's an important part of it. So I think we are, yeah, I'm not 100% confident. Government's telling me they're all there, but I believe it when we've got 3 more days and they haven't changed radically. Couple of suggestions coming through about can we use more local comms, and Ricky will pick those up with our comms team about can we link with BBC West Midlands or Birmingham Updates. There are lots of channels out there that we are linking with, and we also work with local community radio stations as well. Benita's put some really helpful links for people in, and then I think the final one I've got to the bottom of the chat at the end. Oh no, you're coming through now. So Amy's put in about linking across the voluntary sector. Yeah, we've got lots of work with BCVS on that already, and again linking in with Ricky with ideas on how we can strengthen to that, and we can put the link in to the national map as well. We can send that round to people as well. And Majid's got all political at the end about believing government, so I'll stay out of that one and probably finish there and hand back to Ricky, if that's all right, everyone.
Thanks, Justin.
Thanks, Justin, for that. Apologies, I need to take it up with my internet provider. What's happened there? So yeah, thank you, Justin. As you could probably see, the amount of questions coming through is was fantastic, and it's the kind of attitude in terms from what Justin has in terms of that, trying to be as transparent as we can be, working together, you know, giving real information. So I can assure you that information, what Justin said, is the same quality and in terms of information that the rest of the team are getting. So these are the kind of bits that we're trying to promote, and the benefits of becoming a champion is to try to give you as much information as we can. What you'll be seeing in your chat function, and we'll be sending it out later as well, is some of our social media channels. So we've got a Facebook page of A Healthy Brum. We've got an Instagram page as well. We've got a YouTube channel, which Justin was talking about, some of those programs of, you know, mindfulness at home, yoga for beginners, home cooking, becoming physically active. These are the key little videos that we've uploaded. We're open for any suggestions. If you guys have got some things, we want to encourage that to bring it in, to send it through to us. What is also interesting is the way how these platforms have developed. So we've tried newer things to try and get our messages out. So sponsoring ads is a new thing from our account in terms of getting information and engagement around there. And you know, we are starting to see a lot of positive engagement. I think it's very crucial and important to remind that, you know, a lot of negative stories actually spread a lot faster than positive. So when we're putting information out there, you know, to penetrate and get through all of that, it makes our lives a lot harder, and that's where you guys come in terms of sharing that information. What I want to do is just sort of in closing, just show you exactly a kind of resource where you guys can actually sign up and get some information for your own socials, or know exactly where to some of the latest the latest guidance is out there. So what I'm going to try and do is just going to share my screen for a second. Okay, let's see if that works. Okay, just 1 second. Okay. Can everybody see a public health resource centre?
Yeah.
Someone? Yeah. Okay. So what I've got here is this is the actual public health campaign resource centre which we use. So anybody can sign up to this one. If you have got a .gov or a .nhs email address, you do get a little bit more of resources, and that is because of public health campaigns or embargoes that they've got on there. However, anybody can sign up to this and get some of the resources, especially if you're a local business or a charity. This is a really good resource to use. What we have here is we've got campaigns. Now, what's really important is what we've got coming up at the moment. So this is where you get all your Better Health, Every Mind Matters information, your local outbreak communications toolkit. This is the workers' flu immunization program. So these are the latest information around the flu campaign, school resources, Start Fit for Life, some children's kind of like Disney 10-minute shake-ups. So this is a really good active campaigns resource center for us to use. So what I'm going to do is I'm just going to show you one of the ones that we've got here. So mental health was a big one that was talked about. Justin did. So what we can do, click on the resources, and now what you have here is some of your posters that you can use. This is like a resource card that you can send out. You've got some animations that you can use for your social media. You've got a handout, a digital handout that you can send to your colleagues. If you're a pharmacy GP, they've broken it down to such an extent that they've tried to make it as easy as possible that if you were going to do that. And that's why we kind of promote a lot more digital campaigns than we do from printed, really from the fact that because of costings for one, and the amount of times that the updates do get changed is a key factor. So this is a Better Health one. And you might see this on our social media. So I'll take us onto our social media shortly. And these are sort of the animations around social media, around there, some statistics. These are open planned. So if you're an organization and you wanted to add your own bits, you've got free text to do that. I'm going to show you in terms of from our Twitter our Twitter account. So what we have here is some of the latest kind of messages that we do. What I would actively say is, if you really want to know some of the key messages that you want to do, then please follow our social media. So that's Healthy Brum or the Birmingham City Council Corporate Council account, which is Bum Council. Okay. So if you look on if we have a look on our profile, you would see here some really basic information of where to signpost people to. What we will be trying to do is trying to localize this as much as we can. But most importantly, what we've started to see here now, we've got some community organisations who we commission, who are doing an excellent job in translating some of the materials into different languages. This has been a real thing for us in terms of trying to getting dissecting national guidance into local format, and then trying to translate as many languages as we can. I'll show you our website where we've got a translated guidance piece, so where you can download and share that resource. In fact, I might do that now. Just makes it a little bit easier for me to do. So if I go to our Birmingham City Council COVID page, just put it in fully. So if we go into here, we come to our home landing page, and on here is we have a section here which is like test and trace. Here's your section around the community champions. So we will be developing, and we've taken some of your ideas on board around the dashboard, and how we can try and put that a little bit more clearer. But when you go down and there's some accessible information, if you click on translated information, so this has been one of the big ones, you'll get different areas, different sections of translated materials. Now, the caveat with this is that as the guidance gets changed, we have to then take it down, try and get it amended and put it back on. So sometimes it does take a little bit of time. So we've got here FAQs and different, but if we take something in like test and trace, you can see that Test and Trace, it's available to the audio translations as well, where possible, in different languages. Okay, so it's just a resource. We'll put this out in different stages as a reminder, as a gentle reminder of some of the information that's out there for you to share and cascade out. I will be trying to do a little at some stage. I will do a bit of a social media workshop for you guys, and you know, take you through in terms of how we've been operating and some tips and tools that you know, hints that you can use yourself. How we've used different programs such as like Hootsuite to schedule and program some of our information out at different times. Why we choose certain times to put information out. That's always been a real kind of a little trick that we've learned over the years, and especially over COVID, and especially since people are working a lot more home. Some of those times of travel where people would be having that information is not the same as it used to be. So Claire has kindly put the our COVID champions inbox address in our chat. So, after today, some of you guys might have decided to kind of digest some of this information. You have some outstanding questions, please put it in. And then what we'll be doing shortly is over the next few days, we'll be sending out a couple of texts, a few emails maybe, and then we'll try and plan our next one approximately 7 to 10 days. So definitely we're going to keep this going as regular as we can, especially during these periods. And in fact, if times need to be where we need to increase it, I'll be trying to get Justin, preloaded on here as early as we can. Once we got the flyer, we'll get it. We're building up and building more structure around this, and then we'll see where we can go. Obviously, I'm not as knowledgeable as Justin in this. Is there any sort of closing questions that you want to ask me at this point? But please, not at the level of what came before that, in terms of how, just on some of the things that have been mentioned. Okay, so I'm taking a big risk here. How regular will these meetings be? So we're planning set every kind of 7 to 10 days. So if we can get a meeting like this, that'll be fine. What we're going to do is record this. So if anybody can't make it, then we'll send the link out so people can do that. We've already had a few requests from some of the fellow champions where that's the case. I understand if there's an important match, people might have other priorities, I'm guessing. I can see you laughing there, Reg. Okay, can you share these resources with us, please? Yes, we'll send out we do class it as a kind of a master email with some of the resources that's put into it as well. As I said, I'll do a social media little workshop for anybody who wants to have a look at how you can utilize these tools as well. As a councillor, I've had a list of awards that I have to go in the next few days. Can that be shared? Yeah, I'll try and take that back with the drop and collect team. Perhaps Dean O'Motti or Nicola Bryant can to help on that subject. Okay, right. I'm going to take the big risk and say, oh, we've got the thank you, so I'm going to do that. So Shamus. Okay, yeah, Shamus, we'll take you up on that offer. I can learn a few things. That'd be great. So we'll be in contact outside the offline with yourself. Okay, guys, I'm gonna call it an end there. Thank you very much for attending today. Really appreciate it, and a big thank you for being part of the first COVID Community Champions meeting in Birmingham. Thank you, guys. All the best. Have a great evening. All the best.